Thank you. My name is Frankline Mutema. I work for Ministry of Health, Kirinyaga County in Central Province, Kenya. Currently, I coordinate TB and leprosy activities in the county. And recently, I was given to head the directorate of the programs and the partners within the county. The training came, it made us understand our data because we were using to look at the data in a crude way. If I say I'm reporting 200 patients, I would feel that in this facility, this is too much. But when we are talking about the catchment population, how you calculate your case notification rate, we realize that we are doing very low. And that is the time I realized that the course was very useful, that I could understand that I am missing cases. The other thing is that I also understood other indicators. When maybe you could have lost maybe 2 patients, or maybe you have lost 10 patients out of possible numbers. When you look at the percentage, when they tell you the magnitude of your death rate, that is the time it will hit you that this is too much. We need to come back down and make sure at least the numbers were actually very low. The number might appear very few, but when you look at the rate or the percentage, it's very, very huge. It made also a great magnitude of the same. Apart from the death rate, it also meant about the loss to follow-up, the percentage, and also the impact these patients whom we lose during the treatment actually interfere with the control of tuberculosis within the community. And also to expose us like the failure rate. It will tell us that when you have this number of people failing, why are they failing? Is it that they are not adhering treatment? Is it the medication factors? Is it the patient factors? Or maybe other factors associated? I felt that the union was actually very useful to me to understand more when it came to TB management in the community. This one was hands-on. So when I mean hands-on is that the facilitators would teach you practically in the tracks. And then there was also the field experience was the most exciting. Because I remember like in where I work, we used to most of the trainings in our facilities. We could go to different facilities and look at the hands-on. So we could open our eyes in the field and see this is how we fill the register. This is how we use these indicators to get the target which is supposed to be given. And they could also show you how progressively set the target to achieve. I remember we actually ranked #1 in the country as the best county in the TB management. I think the trophy is in my boss's office. And due to this, many counties came to learn from our facilities. And this really gave us an opportunity to see what other people did. And we realized it was actually very useful. And this one really encouraged us not only to handle the TB within the public, but we also were able to move to the private sector and include them in the TB care within our community. So I felt that it has built not only me, but also my colleagues both in the public and the private. And the success of it was in 2018 when we were ranked actually among the best counties in the country. Actually, not only on tuberculosis personally, I would say that this is a course which opens somebody's eyes. I remember the teachers then or the facilitators, they would tell us as we learn tuberculosis, it's also important to get a challenge, even of your own, maybe your lifetime, what you want to do. And as we implement this one, you can also implement this one. So I would recommend it not only to the TB programs, but also programs like non-communicable diseases, which are having a challenge within our population. We can be able to make decisions using the data available, analyze it, and make decisions to look maybe for the support or guide people on how to use it. So it is a very, very good course. And personally, I not only manage the program, but I also have a human resource, I think, which we use. I've been using this one to argue with my bosses when I need an extra HR, maybe a clinic officer, a medical doctor, or a nurse. I would project the data versus the human resource. So this is the time now I'm able to use the course I learned outside the TB world to make those decisions and guide maybe by my seniors on how to make decisions, especially in distribution of other resources, including human resource.